deep plane facelift, facial rejuvenation, and rhinoplasty.
So at one point during the consultation, did you decide you want to do your nose?
I just asked the question, when my face is pulled up, will my nose look bigger?
Very reasonable thing to consider is facial harmony, facial balance with the nose as it pertains to the rest of the facial aesthetics.
So how did you break the news to your family?
I just said I'm doing a facelift.
You're doing surgery, but there's artistry involved. That's the most important thing.
It's hard to put descriptions on artistry, but I mean, generally people develop a bit of an eye for aesthetics.
And would you say the age you did it was the right age?
I think between 50 and 60, 65 is every woman should do it, in my opinion.
How do you think this impacted you on in your professional life?
I would say it had a very positive impact on my career.
Hi everyone, welcome back to another episode of Unfiltered. Today we have another guest who's undergone a deep plane facelift as well as a rhinoplasty. This is not an uncommon combination, and we can discuss why the patient decided to do her nose at the same time as her face. So I'm going to turn the mic over to Nancy, who's going to take us through a discussion about deep plane facelift, facial rejuvenation, and rhinoplasty.
Hi, everyone. So today we are joined by Nina. She's a 63-year-old woman who came to us originally for facial rejuvenation. During the consultation process, and once she decided to do surgery, she thought, maybe I'll do my nose too. So it makes for an interesting topic of conversation. Where you were in life when you decided it was time for a facelift?
I always wanted to do a facelift when I turned 60, but it didn't happen at 60 because the procedures that I saw out there looked very fake and very complicated. So I just let it go. And then I came across the idea of the deep plane facelift. I saw it on social media and I thought this is something I could do. So then I did some research. I found Dr. Solomon in this clinic through another surgeon that recommended you.
So what qualities were important to you when you were making the decision?
For me, one of the most important things, other than researching the reviews on the surgeon, was actually, is the surgeon interested in me as a person? Does he listen to me? I found that Dr. Solomon was great. You were not dismissive. You were very patiently listening to me, to my concerns. So I felt I was going to have really quality service and not be treated like a number.
So at one point during the consultation, did you decide you want to do your nose? Is that something you've always wanted to do?
No, actually. I've always said that I had my nose like my dad, a big fat nose. And what happened once we agreed, and my husband was amazing, very supportive. We were doing the consultation and we talked about the facelift. And I just asked the question, when my face is pulled up, will my nose look bigger?
I've never had anybody ask us that before. Is that a fair question? Is it possible that the nose could look bigger once you've done a facelift?
I would say that it's a very reasonable thing to consider is facial harmony, facial balance with the nose as it pertains to the rest of the facial aesthetics. So the nose is the center point of the face, obviously, and as one ages, the nose does become longer in many cases or appear longer, starts to droop. So a lot of people do consider rhinoplasty in conjunction with anti-aging surgery such as facelift. It's not so much that the nose would look bigger relative to the other structures. Extreme circumstance where someone undergoes facial rejuvenation and the nose looks elongated may look out of line with the rest of the face, or the age may be discordant. Something that we do talk about with patients, I think Nina interestingly brought it to the conversation. I'm glad she did, because I think it did overall enhance her aesthetic outcome.
And the way you answered it, it wasn't necessarily that it was going to look bigger, but you said I could use some refinements. And I love my nose.
That's so
I
nice.
really do. I'm so glad I decided to do it at the same time.
She now has a little bit more of a gentle slope, and that gentle slope definitely makes the nose look more youthful. Yeah. So how did you break the news to your family that I want to do a facelift?
I just said I'm doing a facelift.
So there was no feedback needed. You just decided. Yeah.
I have one of those husbands that's extremely supportive, and he likes me to shine and look beautiful. He was concerned a little bit, like some degree of nerves, but came with me to the consultations, and he was very supportive. And then supported me every step of the way with the medication and making sure I followed all of the doctor's orders.
So let's talk about surgery day. I want to just delve into the patient experience a little bit. The night before surgery, the day of surgery, how was that for you? Did you find it very anxiety provoking? Were you ready for surgery day?
Yeah, I was literally counting the days because I was so excited. The night before, it was like this heavy feeling, but I was calm, reasonably calm. The morning of, I was like, okay, let's do this. And I was excited to get it over with, basically.
I'm trying to remember, did you have IV sedation twilight or did you have general anesthesia?
General.
You had general anesthesia.
Yeah. And then when I arrived here, one of your nurses, she's amazing. She just made me feel very comfortable. You're going to be okay. Just reassured me, even touched my hand and said, we've got you. You're going to be okay.
And what was the first week of recovery like for you? Just for those who are wondering, should I do a facelift? What can I expect? It's always nice to hear it from a patient and multiple patients because everyone's experience can be a little different.
So everything you gave me in the dossier happened exactly at the right time, that it's like the swelling on the third day got more, and then it started going down. I had a hard time breathing, obviously. And because my throat was raw from the intubation, it was hard, but manageable. I actually came off the medication that you gave me after 2 or 3 days, and I was just having Tylenol. So I would say it was manageable.
Was there any point in time during your recovery, the first week particularly, where you felt discouraged or it's challenging to look at yourself? Because it can happen because the results aren't immediate. Yeah. It does take a little bit of time. Sometimes people can see results at the end of the first week, sometimes the second week.
I had 1 or 2 days where I was feeling down just because I felt I wasn't in control of my body and I wanted it to happen faster than what it was happening. But then I took the dossier and read it again. It's going to be 2-3 weeks. But I did go out for dinner after 3 weeks. Went to a restaurant and I felt that I looked fabulous, so it didn't matter.
You did look fabulous.
Even though I was still swollen.
So you came to Dr. Solomon for his deep plane technique, his natural results. Were you ever concerned that, am I going to look so different? People are going to notice that I had a facelift, or just worried about the outcome generally?
I knew it would be natural. I researched Dr. Solomon online, and he's known to have natural-looking results. I saw also a gentleman that you did where he was saying his friends were wondering, didn't he? You look so good, right? I wouldn't want it to be so obvious.
I think you look great. Do you mind sharing
you.
how old you are with the audience?
63.
Yeah, you look amazing.
Thank you.
So how did you do it? What's the artistry that goes on in order to get this result? You're doing surgery, but there's artistry involved. That's the most important thing.
Yeah, it's hard to put descriptions on artistry, but I mean, generally people develop a bit of an eye for aesthetics, and you do this many, many times over and over again. Some of it becomes second nature. I think it's like musicians ask how do they feel when they're on stage, not really thinking about it. They're just doing their performance. Surgeons who do a lot of operations in a specific field get an eye for detail that comes from doing hundreds and hundreds of cases. So, it's that rule, 10,000 hour rule. I think you do just get better. Some of it may be innate artistry. Some of it comes from just experience. And then it depends on what your patient's aesthetics look like to start with, what their goals are, and then hopefully finding some harmony. Some patients leave it totally in your hands where you're trying to restore her. I mean, she's a beautiful lady. We're trying to restore her looks. Some other patients may want to change their look a little bit and want to do things maybe to look just different. It really depends on what they're after. So the majority of the patients want to just look natural, younger, more like they used to. Some patients I find want to reshape their face. They never were happy with their genetics. They want to maybe put a chin implant or a lot of fat grafting. Some of those procedures can be really powerful in improving aesthetics, but then you may be going for a different look. In this particular case, we were mostly trying to stay natural and restorative, which I think we did. And she's a beautiful canvas to work with to start with, so it makes it easy.
And you were a good listener because you did exactly what I wanted, and the recommendations that you gave me were based on your knowledge. So I knew I was gonna turn out.
How
Me
is it?
too.
How has it impacted your confidence at this stage of your life? And you're a career woman. You've got a career.
Yeah, so I've always had good confidence. I'm a real estate broker. I lead a team, and I'm on social media. But now I have to use less filters. Now I don't have to narrow my nose. No, it's nice to actually have this feeling of youthfulness. Yeah.
What would you say to somebody who's on the fence about doing a facelift? And would you say the age you did it was the right age? We get a lot of patients asking, when is the right age? It's always a good question.
I mean, I see women are doing it very young, but I think between 50 and 60, 65 is every woman should do it, in my opinion.
And how are your scars? Are they healing well?
Oh, they're really good. Yeah, they're really good. I mean, they hurt. My ears are still a bit swollen.
And how many weeks are we now? Are you
in 5 weeks?
5 weeks post-op.
Yeah, still some swelling, but
and this is your nose 5 weeks post-op as well, because that takes a full year for the swelling to subside and resolve. So that 5 weeks, it looks beautiful.
Oh, thank you. Yeah, so I would definitely recommend for women and men to look into it. It's the procedures these days are so incredibly amazing. They're not like they were 30 years ago. And when not that I would understand the precision of what you did, but when you work with a qualified surgeon, it makes all the difference in the world.
Any advice for patients?
When I told my family doctor, and she does cosmetic like Botox and when I told her I'm getting a facelift, she goes, oh, so I emailed and she said, I want to see you. So I went in person and she said, why are you doing a facelift? I thought she was going to discourage me. Who are you doing it for? I go, for me. And she goes, that's the answer I want to hear. I just want to make sure you're not doing it for your husband or someone else. You're doing it for you, the psychology behind it. And then she asked me, who's your surgeon?
Of course.
And I go, oh, Philip Solomon. I don't know. And she said to me, he's the only plastic surgeon I follow on social media. Oh, and nice. She believes she's met you
at a
conference.
She sounds like a very nice,
fabulous
family doctor. Yeah, genius doctor. No, she sounds very caring. The fact that she brought you in for that, you're lucky to have her.
Very good doctor. Yeah,
that's nice.
So it was really interesting that she asked me that question. But if you're doing it for you, then you feel better about it.
So one last question, Nina, I wanted to ask you, if it's not too personal, how do you think this impacted you on in your professional life?
Oh, I think it's had a really nice impact when you feel when you feel better because you look better. I think you carry yourself totally different out there in the world with your clients. Just you're more confident. There's more inner happiness. So yes, I would say it had a very positive impact on my career.
Oh, that's great. Yeah. Thanks everyone for listening to another episode. I want to thank our guest who was phenomenal on camera. I mean, she's a real natural. And if you need a great real estate agent, you do mostly the West End, right? Is that where you do all over?
Yeah, I go everywhere, even Scarborough. And yeah.
Well, she's terrific. And thanks for tuning in, and we'll see you again for our next episode of UnPhiltered.